Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the number one podcast of patient advocacy, affirmation, and education. This week we are talking about Men's Health Month. Obviously, this is the month of June, and it is all about men's health. Again, if you're listening to the podcast, I try to harp on men's health every single month, but and from a national perspective, the month of June is all about men's health awareness, and of course we wanted to touch on really some of the background onus of why it's so important. I think sometime throughout this month we'll also touch on specific disease processes like prostate cancer for sure. I think I definitely need to touch on, but I think more importantly we want to really just harp on why men's health is so important and why the lack of awareness has been killing men for years now. Again, if you may not know, and we'll talk about this on the podcast, men's life expectancy has been shorter than women's for almost 2 decades, right? And it is not changing anytime soon. And we're going to talk about some of the reasons why. So if you are on Apple Podcasts, Spotify, make sure to leave us a 5-star review. Go ahead and share this podcast out with 5 to 10 other friends, especially your male friends who have not gotten their checkup no time soon and are walking around here like everything is all good. Today's podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. And for the thanks of being a devoted podcast listener, I'm going to give you opportunity to save 10% off today's purchase using the coupon code EMPOWER10. Go to shop.drbarrypierre.com. Use the coupon code EMPOWER10, all one word. You will save 10% off your entire purchase. Remember, 50% of all proceeds are donated to the 5-Star Scholarship Foundation, which is a nonprofit organization giving out scholarships for high school students. Today, we are going to talk about Men's Health Month. This is the month of June, especially depending on when you're watching this or listening to this. This is the month of June, and we are going to be kind of focusing and really calling out our men during this episode because we want folks to really get it together, right? Understand that there are a lot of issues. We talk about health a lot, of course. Obviously, this is you're not listening or watching me unless you're want to know about your health, right? But a lot of times we need to focus on the fact that men, right, that the gender of men, suffer a lot of ill-related issues, whether it be due to cancer, whether it be due to just having shorter lifespans, whether it be due to, the risk-taking activities that they partake in. For the past 20 years, men have had a shorter life expectancy than women. And, there's no really secret behind it. And there's a lots of different reasons that I've talked about, a lot. And I think we really want to hit home. But I like the month of June, right? Because you're going to see a lot of focus on men's health related concerns, whether it be due to prostate cancer, whether it be due to lung cancer, whether it be to their smoking history, a lot of different things that are really kind of obviously, can hit men and women, but really hits men the most, right? We're definitely going to be talking about throughout the month. This week, I think in the month of, I want to say the second or third week of June, it was actually a whole week, right? So not only is this Men's Health Awareness Month, but the second week of June, the 14th to the 20th, is actually, in fact, let me tell you the exact dates. Yeah, 14th to the 18th, right? We'll focus on there because that's the Monday through Friday. It's going to be all about Men's Health Week, and we'll definitely kind of touch base on that when that week comes about as well, too. So, why, obviously, as a physician, do I like to call out the men, right? And the reason why I like calling them out because it's really important. We've talked about here the importance of getting the annual checkup. We know that men are at least 20 to 40% less likely just to get their annual checkup than women. And I've talked about how the annual checkup can sometimes be the make it or break it appointment. And I can tell you as a hospital physician, the amount of men that come into, the hospital And when I ask them, hey, when's the last time you seen a doctor? And a lot of times it's 3 years, it's 5 years, it's 10 years. It's so long ago, that they have no medical history, right? And that's always the funny thing, right? They say like, yeah, I have no medical problems. And then my follow-up question always is, well, when's the last time you saw a doctor? And like, well, it's been like 5 years, it's been like 10 years. Well, it's not like you don't have medical problems. You just aren't seeing a doctor to diagnose your said medical problems. So, and it happens a lot, especially when we talk about heart disease, especially when we talk about diabetes, when we talk about cholesterol, all of the disease process that we talk about a lot on this channel affects men at such a significant rate because of just the lack of action, which is surprising, right? You would think, men would be all about gung-ho, ready to get it. But when it comes to their health, it's not. When I was doing outpatient medicine, when I first got out of residency, one of the more common scenarios to get a man in my office to come see me, especially for either an annual check or just kind of a complaint related visit, was either they had some sexual related dysfunction. That's one. Or they had a family member, whether it be, a sister, whether it be their mom, whether it be their spouse. They had someone who was saying, hey, you need to go to the doctor's office and at least get a checkup. And those were like the two primary reasons why, to the point where it'd be funny. Like I'd have the husband, let's say if it was the spouse brought him in, I'd have the husband in the room and I'd ask him questions. And then right afterwards, the wife would be like, hey, did you say this? Did you say that? Did you say just to make sure? And I could tell that was like the big reason why they came, because the wife or their spouse was like, no, you need to go and see that doctor like ASAP. So, and we can't ignore that aspect, right? We can't ignore cancer-related deaths. We can't ignore, especially when we think about, and we're going to talk later probably this month about prostate cancer specifically, but we can't ignore there's testicular cancer. Again, one of the most common related causes of cancer death in those of the ages about 15 to like 35, right? So at a young age, which typically gets undiagnosed. Why? Because they don't come to the doctor's office. They don't seek help until it's too late. And here and in the Lunch and Learn community, we're all about how do we seek help early? Because again, it's one thing to have hypertension, but if you have hypertension and I catch it early enough, it doesn't cause that much problems, right? You can have diabetes, but if I catch your diabetes early enough and I'm able to manage it early enough, it doesn't have the problems that it can when I don't. And you don't want to see me in the hospital 5 years, 10 years, 15 years after you've had this disease process that you've essentially ignored, and then want me to do something about it, right? Because then by that time, you've ignored it. So now you have a stroke, right? You've ignored it. Now you have a heart attack. You ignored it. And now you're in kidney failure. You've ignored it. And all of these other issues that could have been avoided if we would have just hit it head on isn't there. And I like to think about, especially when we talk about the gender, why men go see a doctor, why women don't, go see a doctor, why men don't go see a doctor, why women go see a doctor. I think a lot of it just has to do with just the conditioning, that starts even when we're young. When we get hurt, we have to quote unquote suck it up. We have to kind of deal with it. We kind of have to internalize it. And we just had to keep on going. Whereas typically for our women, especially our little girls, we don't really instill that level of, just suck it up and do it yourself. We don't instill that in women, right? So women know that if they're hurt, they should go seek help, right? They should come to seek, a family member, a parent, like they should go seek help. Whereas men is like, hey, you fell, get back up, wipe yourself off, pick yourself up again and do it on your own. And I think we carry that mantra onto adulthood. And you'd be surprised, again, even as a physician myself, my friends, right, especially my male friends, right, they don't see doctors a lot. And of course, obviously, I'm going to call them out on not seeing doctors, but they don't see doctors a lot. And it is because they just kind of like, I don't have any problems or I'm not feeling any issues. And that's where we kind of go back to the fact that because they're not experiencing any issues, they don't think they need to go see a doctor. And really, when it comes to like awareness, right? We have to just be aware that there are problems that will arise in us long before they arise on the outside. So there'll be issues like blood pressure, like cholesterol, like diabetes, like prostate related issues, sex related. There's a lot of issues that will occur in us early before we're actually symptomatic. And because we are not in the mindset of you know what, let me just go and get myself checked up, even though I have no problems or no complaints at this moment, we always fall behind, right? And I think that is the very underlying theme associated with, right? And again, this is an issue where, and I'm not even talking about kind of the socioeconomic related standpoint, right? Like when they factor in, that finances aren't an issue to go seek help, when they factor in that, that access isn't an issue to go seek help, men still routinely go see and go involve themselves in their own healthcare than women at every single stage. And if this month, right, if this video is the first time, someone's calling you out, I hope that's what kickstarts you, right, to go get stuff done, right? And you're never too old. Right. You're again, whether you're, 15, whether you're 20, whether you're 30s or 40s or 50s, like if you have to think about the last time you saw your doctor, go and schedule your appointment. Right. Because again, there's so many things we have to worry about. We have to worry about colon cancer. We have to worry about prostate cancer. We have to worry about lung cancer. We just have to worry about diabetes. We have to worry about all these disease related processes that we know can affect us at a significant rate if we don't get it taken care of early. But because we're not doing it, right, we're falling behind. And then what's also been shown, like, especially if you gotta do a little Google search, right, and look up, men's health facts or disparities, like it always talks about how, regardless of, the time frame, right, like our life expectancy is shorter. And we have a lot of accident related deaths, right? And that goes back to that level I kind of talked about, the machismo aspect, right? Like we're risk takers, right? Men. Right. We're risk takers. We're willing to do some things. We're willing to, smoke more. We're willing to drink alcohol more, drive more. We're willing to do very dangerous related things that affects us. And unfortunately, it's killing us at a much, younger rate than it is, our women. But again, I have to understand, and I always kind of preach this, especially to my men. Understand that, when you're going to get your wellness checkup, when you're going to get your health physical, when you're going to make sure you're taking your blood pressure medications, taking your diabetes, when you're actually doing those things, remember, you typically have more people that you are responsible for. So it not only affects you, right, when you don't do those things, right, it affects a circle of family members and friends that, that will either learn from your good habits or learn from your bad habits. Like imagine me, right? Imagine if I was a physician up here, but I didn't go get my routine checkups, right? Imagine if I was a physician up here and I wasn't on here screaming like, hey, man, get yourself together. Like imagine if I was doing that, then I'm setting that example for my friends and family members, especially the men who are my friends and family members, to say like, yeah, you know what? If Dr. Pierre is not necessarily too worried, right, about, my health and about men's health in general, like I don't need to be worried about it either. But like, that's again, clearly not the case. I kind of mentioned earlier in the show, I'm approaching 40. So I know at the age of 40, there are certain benchmarks that I have to be concerned about, right? Like I have to be concerned about prostate related issues. The guidelines for colon cancer just recently changed, right? So I have to be concerned about colon cancer related issues, right? I have to be, like, I don't smoke, right? If I was a smoker, like I'd have to be concerned about lung related issues. There's a lot of things I have to be, keep on the front of my mind, not even the back of the mind. I have to keep on the front of my mind. And we shouldn't allow, or we shouldn't have to wait until a month like June comes around, right? Or Men's Health Week comes around to say like, all right, we need to get it, right? It's because everyone is familiar, right? We have a whole magazine, right, dedicated to men's health. There's a whole and it's not about just whether you lift weights. Right. And I think that's again, I'm a good story for that. Right. But like, it's not about just lifting weights and looking good. Right. When you're in the gym. And I think that's one thing that's very important. I remember when I was in outpatient practice, I was taking care of one of my patients who, new patient came to see me and he had a heart attack. And only had a heart attack, he suffered a cardiac bypass. So he had to get a bypass surgery and he was in the gym like every day. And I remember him telling me like, doc, like I thought I was doing enough because I was going to the gym every day, right? I was lifting weights every day. I was eating correctly every day. I thought I was enough. And I said, well, like, yes, I understand you're doing that, but like, were you also going to see your doctor just for your other issues, right? Because again, you could still go to the gym, right, and have high blood pressure. You can still go to the gym and have had uncontrolled diabetes. You can still go to the gym, right, and have uncontrolled, like you can still go to the gym eating healthy, and still having these problems concerned. And that totally blew his mind. And I could tell just the aspect of that light bulb that had to hit him, unfortunately, while he's in a hospital suffering a heart attack. Like the light bulb that hit him was like, wow, like I need to do more. Right. And he became like one of my biggest advocates in the office. Right. He was like, Doc, I'm telling everyone in the gym, go see your doctor, get your routine checkups, get your lab work, all of these things that like for men, we tend to kind of brush by the side. So before I go, right, like I just want to make sure that the men who are listening, who are watching me saying, like, why is Dr. Pierre kind of focusing a whole episode on us? It's because I care about you. Right. It's because I love you. Right. But more importantly, it's because there are other people you got to take care of, most likely. Right. There are other people you need to be there for. And we can't make the excuse like, well, I was going to work all day. I was doing like that's not an excuse anymore. We have to take care of our own. We have to take care of our own body so we can take care of others. Right. It's just like when you're in the airplane. Right. And they say, put your mask on first. If you are not putting your mask on, aka if you are not taking care of your own personal physical health, mental health, spiritual health, if you are not doing those things on your own, you can't take care of anybody else. So so for my men, right, who are watching this, who are listening to this, for my women who, has family members, right, who, they haven't gone seen the doctor in a while, who, they haven't gone, got their regular checkups in a while. Urge them, push them, stress to them how important it is to do so. And not just because this happens to be Men's Health Month, but because after Men's Health Month, we're still going to have to be concerned about, our men getting their wellness checkups. After Men's Health Month, we're still going to have to be concerned what's their mental health like. We're still going to have to be concerned of all of these things here. And we don't want to let a month come by to us to kind of remind ourselves to do so. Again, like if you're me, like on the way I remind myself I need to be fully aware of my health is that every time around my birthday, I have my annual wellness checkup. My birthday now symbolizes when it's time to get my annual wellness checkup. It's like it's one and the same now. So if you have to think about like, hey, like on my birthday, I'm going to get my annual wellness checkup, do so. Right? Because you have lots of other people who are likely dependent on you to do that as well. I am yours truly, Dr. Barry Pierre, and I'm going to see you guys next week. Thank you for coming to the end of the episode. It is yours truly, Dr. Barry Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lynch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222. And you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.